Hey, I'm Dr. John Azar-Dickens with Enforce Health, and I'm here with Angela Smith. Angela is a licensed professional counselor, and she's going to talk to us a little bit today about marriage counseling with police officers. She does a lot of work with officers and their significant others, and we're going to talk about the kinds of problems that she sees in her practice, but also how she addresses those problems and what kinds of issues and what kinds of interventions she does to help out. So thank you for being with us today and talking about these issues. So, in your work and dealing with police officers, what kind of problems do you see? What kind of things bring officers to you, and how do you go about addressing those things? But I guess first starting, what kind of problems do they come through the door with?
A lot of times it's anxiety, stress, problems in relationships, infidelity, those kind of things.
Okay, those are the primary issues.
Mm-hmm.
So infidelity, stress kinds are related. The job of being a law enforcement officer is very stressful, stressful on the family. It puts them in positions of stress, and so that can definitely influence the relationship.
Definitely.
How do you think that, what's the dynamic there? I mean, what is it about the stress of the job and how it negatively interferes with their relationships?
When the spouse sometimes won't understand what it's like on the job because the officer comes home and they don't necessarily want to talk about the job, and then it becomes hard for them to share and kind of unload and decompress.
Right.
And they carry a lot of stress with them, with things that they've seen, things that they've been on. It kind of.
So they've had a stressful job, they've been through, or a stressful situation, been through a difficult day, come home, don't want to talk about it. The significant other may want to talk about it. The officer isolates or detaches and doesn't speak, and then
Absolutely.
Causes a lot of communication problems, I would guess.
Yes.
And then it just builds from there.
Mm-hmm.
The infidelity issue, certainly that's a prominent one that you see. What do you think? Do you have any ideas about what may drive some of that?
Well, a lot of officers, they kind of a release of like the adrenaline, the excitement. Can't talk to their spouse, or they have problems at home with kids, finances, and it's just a way of escape, or it's to generate some excitement or feeling like they need to understand that part of them.
So in a lot of ways, it's dealing with stress,
right?
And it's
their escape.
It's an escape. Okay, and then of course, obviously, that causes great problems in the relationship.
Absolutely.
Now, do you find that they come on their own and on their own initiative for counseling, or are they often kind of pushed by their significant other, or are they forced to by departments, or is it kind of all
of the above?
Okay, so you've seen people from all different perspectives.
Correct, and typically it's usually when the stress kind of overcomes the marriage, and they're at the crossroad of, am I going to stay? Am I going to go? Kind of help them flesh out some issues in the marriage in the first place, and we kind of build some communications and some intimacy, and actually educating the family on what it's like to be married to a first responder, those who come up on, tragedy, and they see a lot of trauma, and it's a lot to deal with when you've got that every day and your life's in danger, and sometimes you come up on things that families may not understand.
How hard is it? Do you find that it's hard for officers to A, go to counseling and be involved in marriage counseling, and B, talk about those things openly?
Absolutely. The stigma that they have about coming to a therapist, is it weak or something wrong with me, or things like that. And I find that once they start talking about it, and you have the education and understanding that they're not abnormal, they kind of open up and understand that's just a way most people expose themselves to stress and how they deal with it. Okay. So they're not abnormal.
Right, and once they recognize that and realize that counseling is just as normal as, say, going to see your primary care physician about a stomach ache or a headache or whatever,
Absolutely.
then that kind of eases. Now, as far as confidentiality, if they come to see you and it's not part of the department's requirements, and they're coming on their own, by licensing laws, you can't communicate that to anybody.
No.
Their record is sealed. That information won't be.
Absolutely.
Okay, because I think that's a lot of concern for officers, that
their
something
privacy
happens. Right.
and being labeled, and I've even known that they won't use their insurance, so there's no paper trail, but the privacy is complete. No one knows that they're coming here. If anyone were to call to confirm, nothing. They would not know unless they have a release or gave permission.
Okay. And so some officers will work outside their insurance, pay privately, and I think you do special rates for first responders.
I do give discounts for first responders, EMTs, firemen, police officers, and their family.
Okay. And so have you found that that they make good progress? And does it work? I mean, is it helpful?
So far, absolutely. Sometimes they'll come in and then flesh out some of their problems, communication issues with their spouse. Things will go really well. They'll try it out, and then they're done. We terminate, and they've learned the skills. And sometimes I've noticed that sometimes they have bumps in the roads where they may come back, refresh some skills, learn some new ones, progressing forward. For most of them, I've seen that they will use the skills. Go out of therapy for a while, and maybe a year later or so they might come back and say, hey, I need to build on these skill sets.
Right. So on average, what would you say the average session for a couple would be in terms of length of time? How long do most couples continue?
Sometimes like 3 weeks. I've been as short as 3 weeks, or 3 sessions, or even as long as a couple of months. But depending on the issue, and depending on the family, I've seen them in family settings, couple settings, and one-on-one.
And I'm sure with the infidelity issue, that's something that takes some time to work through.
It takes a little bit more time because you're talking about some other issues that kind of led up to what was going on. So sometimes you may go from anywhere from 3 weeks to maybe 12 or 16.
Yeah, and that's really important. I mean, it's not it's usually something that has built over a long period of time that eventually leads to something like that, right? I mean, it's not, hey, I wake up one day and just make that decision. It's something that happens slowly and can progress and get bigger and bigger and bigger.
Absolutely, and there's where the communication comes in, learning how to talk about it in healthy coping ways, and let their spouse know what they need, and their spouse be able to speak to them, and just realize that they're not alone and that they can get help.
So what would you say to officers just about how to seek out, let's say they've made the decision, all right, I've got some issues in my relationship, I want to address them. How do they find the right person? And what should they be looking for? Like one thing I always talk about is seeking a counselor who has experience with law enforcement, because it's a very unique profession. It's a unique personality. They have unique problems. How would they go about finding someone that would understand the kinds of problems they have, do you think?
Well, they can ask when they call up a therapist to say, do you have any experience working with, law enforcement, with firemen or EMTs or anything like that? Ask them how long and what's their background in working with them and their success rate. You can ask those upfront questions, and how do you handle confidentiality, so that they can kind of ease their mind.
And the issue of being comfortable with the person you're working with. What do you think about that? I mean, do you think that's important? I mean, I know trust, obviously, that you trust the person you're seeing, that's critical, but do you think it's important that they feel comfortable with them, that they feel like they can talk to them easily? I mean, is that an important part of it?
Absolutely, and I always tell people, the connection's important, because you got to be able to connect with the other person, with your therapist, to trust them enough to kind of realize that they can help you and trust you with some things that, people may not realize that it takes a lot of trust to get some of that stuff out, and they need to trust that you're not gonna run away. And also, I tell people maybe about 5 or 6 interviews with therapists. It may take a while to find the right one, but once you find the right one, you have a good resource that you can come back to and revisit. And
so, just if the first meeting doesn't work and you just say this person's not for me, it doesn't mean give up and abandon therapy.
No, it just means try new, and it takes about 5 or 6 different tries sometimes, but get on the average to find one that works for you.
You think it takes that many? They may have to see 5 or 6 different people before they find the right person.
They could. I mean, it's on average, but people get, usually after 2 or 3 they may quit, but don't quit. Find someone that connects with you.
So if you go to somebody you think they're weird, or you just feel uncomfortable, it doesn't feel like a good fit, then it's okay to understand that means, hey, I need to go find another one.
Right.
Okay. All right.
And most therapists would understand that, because it is about connection with that person.
And about the relationship.
Okay.
Well, very good. So if you're thinking that marriage counseling is something you might want to consider, and you think there's some issues in the marriage, strongly encourage it. It's a very helpful thing and can be very useful.